Good afternoon, everybody. This is my latest video blog, and the reason I'm commenting is I've just seen this article here from Chat Magazine. It's somewhat of a horrific article, actually. It's about a lady called Tracy, aged 51 in Manchester, who's basically been advertised a victim of the system failing her. What's actually happened was this lady was 51 years old, not that that matters, 19 stone and a size 26 and diagnosed with rheumatoid arthritis. Well, first things first, it's not called rheumatoid arthritis, it's called rheumatoid disease because it's called basically it's a multi-systemic disease. It affects multiple systems. Okay, the thing here is if you're heavily overweight, what can happen is it can make the symptoms of rheumatoid disease a lot worse because you put a lot more strain in the hips and the knees. So I can wholly appreciate why she wanted to lose weight. My guess is she was probably waking up at night with pain in the hips and the knees. And so, one of the mechanisms of treating rheumatoid disease is surgery. But very often the doctor will say to the patient, "You need to lose some weight before we can operate," and the anaesthetist may say the same thing. The patient will turn around and just say, "How the bloody hell can I lose any form of weight when any form of exercise hurts?" So what they do is they put them through the terribly risky procedure of weight loss surgery. This is a classical case of where it went wrong because this woman has now ended up on crutches because she's so weakened. This is a classic example of basically of the fitness industry and the medical profession not liaising closely enough and not working in collaboration. This lady has slipped through the net, and basically what's happened is the system has failed her and failed miserably, and society should hang its head in shame. This is what should have happened. The GP correctly made the diagnosis. Now, before I go anywhere further, as a former training doctor myself, sorry about that, doctors are not fitness trained. What should have happened is that they should have referred this lady to an appropriately trained fitness instructor to see what could have happened. And there are some around. In fact, I do know some in Manchester who are very, very good. So why she wasn't referred, I don't know. What should have happened is that she should have got a hypnotherapist to look after her mindset issues. They should have got a dietitian to look after her nutrition. The GP would have overseen her health. And most importantly, well, that's the most important thing, and an appropriately trained fitness instructor to look after her fitness. She could have lost weight safely, sustained, slowly, but most importantly, if she would have done that, she would never ever have suffered the way she did. Never in a million years. And what would happen if they would have done that program over a year? This lady would have a full bill of health, and there was no reason why she ended up as basically as weak as she is. So society should hold its head up in shame. If anyone wants to add any comments or ask me to comment on this article, I'll be more than happy to do so. Just contact me via my YouTube page or my Facebook page, facebook.com/James Bond Health and Fitness. Look forward to hearing from you. Cheers. Bye-bye.